Le shebile Raising Babies 101 Infants Edition. Risimulaka Mummies and Daddies. An introduction to the traditional and your pregnancy. Then Ritsanamo Big Dilemma. Ribuaka Eczema and how to treat it. Daily we find out our easy peasy, and it's all about infant massages. Libito Lakaki, Carol Ofori, and once again, it's a pleasure to welcome you all to the show. Before Ritena Kamukhara Khataba, Harashebeng.
Yeah, izangoma ngiyacabanga ukuthi ziyabasiza mama. Ngoba ngiyacabanga nami njalo ngilenkolelo ukuthi njengoba singabantu sikhule vele kakhulu ekuqaleni bekusebenza ngoma. Indlela engicabanga ngayo ukuthi bangabasiza abantu.
I can't say yes or no, but personally, I wouldn't consult any traditional healers or izangoma regarding that because I'm a Christian.
Those traditional healers can help to unlock those things so that someone can give a birth.
Traditional health practitioners in South Africa are increasingly acknowledged as essential providers of healthcare, and the National Department of Health is taking firm steps towards their formal regulation. Kumpienu, we want to know the assistance that traditional medicine helps support women during their pregnancies. To shed light on this issue, Rdula Fadze le Gogo Mule Mnisi and Mkulu Mtombela Mabelangwe, who are both traditional healers. Dumelang lile babeti, dumelang. The traditional medicines ha mea imile. What is the holistic approach? What is the holistic approach for basadi ba imileng when it comes to traditional medicines?
Yona important gagolo, and bomme ba imileng mo nakong e ngata ba tla ka lebakeng la go bana le complications. Firstly, we consult with them, ra ba tlhola ka masapo a setho, re shebe le boteng ba mpa gore bothata ke eng, kapa mpa eo e agegile gantle, kapa gona le any medication that they need to take, like the herbal medications that they need to take, and then we take it from there. Ka ba bang bana le bothata ba hore motho o phela a tsologela ke mpa. Whenever she conceives, mpa ele ya tsologa. Ba bang o thola ile gore o nka nako go tshwara, o tshwarela go kgole. O mong o krea ile gore ke di symptoms tsa pregnancy, mara motho o na le cyst or ke growth. Ntwele ha ile ka mogare e iketsa o ka re ke ngwana ke re go a shebiwa ntho tse jwalo.
Right. Umkhulu, uzongena manje ngifuna kwazi from your side ditlhare tsa a woman or pregnant or imileng wenza kanjani ma ufumana umfazi onemntwana phakathi?
Ziningi kakhulu mama ngoba lezi inkinga akusiyona into esingathi mhlawumbe yanamhlanje. Into yakudala njengomuntu wesintu nophethe ikhambi lesintu, into ebalekile ukuthi mhlole kuqala umuntu ukuthi njengoba ekhulelwe, into ayikhulelwe number 1 iyaphila yini, okokuqala lokho.
Alright.
Ukuthi umuntu uyaphila yini. Okay, mangabe phila ukuhlala kwakhe kulo mama omthwele akukho yini la iphazamiseka khona, noma mhlawumbe alikho yini ithumbu okutholakala ukuthi linamathele kumntwana. Lezi zinto lezi ukuze sikwazi ukuyithola kufanele sikhulume nabaphansi amadlozi. Amadlozi asitshela ukuthi lo njengoba ekhulelwe mhlawumbe akakhulelwe umntwana, mhlawumbe kunehluli elikhona kuye ngaphakathi, ihluli ke yigazi elikhomba ukuthi ngathi khona ithunzi. Lokho ukuthi makuya kwabesilungu beyohlola bafike bethi kunethunzi kodwa sibone ukuthi yini. Manje thina siyakhona ukubuza kwabadala ukuthi yini le ekulo muntu, and then bese sicela futhi ukuthi sipheni ikhambi lo muntu uzosizwa yini. ngesikhathi kusunikiwe ikhambi usuyaqala ke manje ukuthi uhlanganisele lo muntu wenzele ukuphila kwakhe nokuphila komntwana ngoba masingabuyele emandulo vele izibhedlela bezingekho kodwa abantu bebevele bekwazi ukukhulelwa batete baye ebantwini besintu kuxotshe lokho oxotshayo umuntu aphuziswe kuphela kubheke ukuthi lento iphuzayo ayilimazi yini umntwana ngoba kunesinye isikhathi uthola ukuthi umuntu uzethwele kodwa ukuzethwala kwakhe akadelive umntwana ngenxa yezinto ezikuyena ezimbambile eyidinga isintu sakubo ukuthi akadlule kuso oqala ngoba njalo methatha umntwana uyachitheka.
Hi, isikhathi shayile manje, but what a very interesting conversation. Kyaleboga bathong. Thank you nyabonga. Gogo nyabonga mkhulu for coming utlobua lo rena ka tsone ditaba tse. Thank you. Every woman in our country has a right to health care that is suited to her individual needs, including cultural needs. Traditional medicine related to maternal and infant health should be accepted and supported as part of our cultural richness. After the break, a big dilemma, and we talk little ones and eczema. Mo Raising Babies 101 libitso la ka ke Carol Ofore o dutsing le nna mo studio ke Mary Ann Mohale, and on the phone rena le Dr. Gabaza Ngobeni. Big dilemma ya rona ya eczema. Welcome Mary Ann. Welcome Dr. Gabaza.
Thank you so much for having me.
Thank you so much. Thank you.
Awesome. Mary Ann, ke itse gore ona le a big dilemma. Kopa re tlhalosetse gore what is big dilemma ya gago?
Okay, so I've got a 9-month-old baby girl, and her name is Myra.
Yes.
So Myra was born with eczema, and it's a genetic eczema because her grandfather still has it, her dad had it, her uncles had it, so she also got it as well. And it's so bad because the minute it triggers, you can't sleep. You won't sleep. It itches so much. You can see that she's itching and she's niggly, you can't touch her, and she stretches her feet together. Ngahamba ku Dr. Wami and wangipa an ointment to mix with this baby cream. And I did that. It went perfectly. So she bought this 3 times a day. So when I got home, gave her a bath, applied the cream. Dinner time, gave her a bath, applied the cream. The next day she was perfect, like skin smooth again, everything is good. But now when I went back to the doctor, it's out of stock. Not that it's out of stock, but it's no longer on the shelves, it's no longer available. And then I had to now go to the pharmacy, try to see what I can find, because what I was finding, the ointments I was finding is, it's for a mild eczema and not the severe one like hers, So the ointments they gave me, it works, but it's not giving me clear skin.
Well, Dr. Gabaza Ngobeni, what is your advice for Mary Ann kataba ya eczema severe?
Okay. Yeah, well, actually, we need to start from the beginning. We need to go into the causes of eczema. Eczema is a skin condition that is usually starts before the age of 5. She says the baby is 9 months old. There is no known cause, but there's a genetic component to it. So meaning that if there's someone in the family with eczema, then you're likely to have eczema as well. So before we get to actually treating the eczema, we need to know what causes the eczema in the first place, what triggered the eczema. Sometimes you never get to find out, but then it's important to know the different allergens or things that will trigger the eczema.
Dr. Ngobeni, what would you say Mary can do to help ngwana gage right now with the knowledge you have? Does she go alo bona doctor wa gage gape o tswela pele jwang?
Like my advice is that remember we spoke about food allergies. There are other things that don't trigger eczema, so she must just be make sure for like for example, clean her fabrics, maybe change the mattresses, the pillows, because there are things like dust mites that can contribute to or trigger the eczema. So my advice is that she needs to definitely consult because it can be a bit tricky when you do over-the-counter. So she needs to consult with the doctor, or she can be referred to, she can request a doctor to refer her to a dermatologist. And then number two, we now want to identify the triggers or allergens, things that trigger the allergy. I think from the history that she mentioned, I think she has done most of what needs to be done. She has changed the soaps, she has changed, I think, ointment and so on. But I think the next most important thing is to get a cream that will help to moisturize the skin. Remember that dry skin contributes to eczema. So it's very important to moisturize the skin. So number one, get a cream that will help to keep the skin moisturized. Yes.
All right.
And then make sure that the soap that she uses to bath the child is fragrance-free, it's not perfumed.
Right. Well, thank you so much, Dr. Ngobeni. Really appreciate insights tsa gago tsa eczema.
Yeah, I think what I need to do is actually go and consult. I'm thinking the dermatologist maybe will give me more broader information and give me a solution on how to get it cleared.
Thank you so much, Marianne. All the best. I hope that you will a solution for eczema yang ngwana gago.
Thank you so much.
So eczema can be triggered by a whole lot of things, including dijo tsa ngwana, lebese la ngwana, and of course it is genetic. Most children outgrow infantile eczema by 3 to 5 years of age. Talk with your doctor about using a medicated cream or ointment to ease the symptoms. Decoding A to Z. V is for ventouse. A ventouse is a cup-shaped suction device that can be attached to your baby's head to help them to be born. You might have heard it being called a vacuum delivery. Forceps are smooth, curved metal instruments that look like large tongues. They're placed around the baby's head to help pull the baby out. This kind of delivery comes under the category of assisted or operative vaginal delivery. A ventouse isn't used if you're giving birth at less than 34 weeks pregnant because your baby's head is too soft. It's less likely to cause vaginal tearing than forceps. You at home stand a chance to win a 200 Rand shopping voucher at an exclusive baby retailer. How do you get your hands on this, you ask? Well, wena fela araba poto ena. Infantile eczema is outgrown by most children by age 3 to 5 years old. Wena araba fela, true or false? Head to our Facebook page and put your answer right there. Who knows? Ukanda wa wina. Harabuwa, we take a look at how easy peasy infant massages are. Rahutla khoneano, stay right there. A daily infant massage is a great way to bond ngwana gago. To share some hints and tips to get us going, re dutse fatshe le Lena Mongake. Good morning, Lena.
Good day.
Yaanong ke batla go bua ka infant massage. Ke a itse gore bana ba di rata thata and ebile e etsa gore ba robala ga monate.
Yes.
Go ba re tlhalosetse re massage jwang ngwana, especially lesea la rona mo.
Oh, okay. Oscar, first of all, o tlamehile o thome ka o hlapa matsoho.
Okay.
Hands needs to be clean and needs to be warm. Okay. So as much as o qeta wa hlatswa, you need to use a baby oil or baby powders to warm your hands. And everything you do, you need to tell the baby hore gona yaanong mama tlo massager re tlo apola diaparo and to get the baby ready. So each and everything we etsang ko ngwaneng wa mo bolella hore mama o tlo etsa so ko wena, and you keep on doing that into mo boleletseng yona.
Okay. All right. So a re bontshege gore re thoma jwang ke re ngwana sa tlhobotse yaanong ka more yone e ska bata go be jwang ka moka.
Yeah, so whether Leona o tlamile we check if go bata o kana se mo apole wa mo sila ka vest high short sleeve, or o etse room hore e be warm.
So okay, heater maybe ke mariga o ka lighta heater gore ngwana a ska khatsela. Okay. All right, so re bontshe ge re tshwara kae pele, re tshwara mo kae, pressure ya teng e jwang, o tla tlhalosa.
Okay, so first of all, aus Carol o tlamile hore o hopola hore ha o massage ngwana, each and everything we repeat a high 3. A ke re bana learn in repetition.
Okay.
So how we etse how mo massage and then we leave it at that. So until we entseng pele we repeat a high 3.
Okay.
So first thing re etsang ko re introduce a body parts ko kelelong ya ngwana.
Okay.
Yes. So this is how re massage ka teng. O tshwara ngwana ko hlogong. So it's like we introduce the parts. I get kelello ha ibone mmele. Mahlo ke yona bonang mmele. So re trigger kelello re bolella hore motho o na le hloho, o na le matsoho, o na le eng.
Okay.
You've got one head, 2 ears, 1 neck, 2 shoulder, 2 arms, 2 hands, 1 body, 2 legs, and 2 feet. Then you repeat that.
Okay.
So like everything, you do it 3 times.
3 times,
yes.
okay.
Depending on that day, obata who stimulator in. So today, we'll do our feet,
okay,
and then we'll do our back and bumps.
Okay.
So I will explain.
Massage the bumps.
Yes.
Yeah, but hey, kaiti na kia for massaging about bumps.
Yes.
Okay.
So we'll start with the ears. You need to massage the
so
ears.
how to massage it? So relax.
Yes, yam relaxer. It calms the baby down, and again balance again.
Oh.
Yes, and again remember we have a massage. We prepare our future.
Okay.
So it helps again with the language, speech.
Okay.
Yes, that's why we say you talk to the baby. Remember the message goes through, so it's easy for a child to learn the language.
And then pressure obviously because it's a pressure. Okay. All right. The last tips massage
one thing the bumps. So the bumps are very important in terms of crawling.
Okay.
Yes, because they are connected limautu.
Okay.
So so and make sure ngwana has suffocate you kenya pillow or something, and you put something a distracting or like abatlo grab a toy.
Okay.
So wadi like how to like so so you need to be patient and soft. So this it prepare our ability strong legs or a crawl. Yes, lore askabula di kena ka mogala.
Hi lena o rutile bathong. Hey next time but of course you be soft and easy on the children. Thank you so much.
Thank you.
I know my baby loves massages, so coming up next, we're going to be jumping into our Yummy Mommy. Ke nako ya go dula fatshe le Yummy Mommy wa rona gompieno. Yummy Mommy wa rona ke Puseletso Kobedi, better known as MzansiMom on YouTube. Also, Mamuruti, welcome Puseletso.
Thank you so much for having me.
So, Hartomeka Mamuruti, right? What is it like Khoba Mamuruti, a young Yummy Mommy Mamuruti?
I will say the expectations are really high. But I think people are very understanding. But very vibrant because I'm young. But it's really not that bad. It's daunting, but I'm coping. I really enjoy it. Yeah.
So earlier mo episode ena rilera bua ka eczema. Did they ever encounter eczema as babies or at any time?
Yes. So currently, Kinali, a daughter and all 4 months.
Okay.
Your eczema high is really bad. Yeah. So we had to remove it to a dermatologist because I tried the Dr. Google way first, trying all different products, and it wasn't working, and it was just making her skin worse. So Karere Kimise, dermatologist, we went to a dermatologist, and yeah, she's fine now. It's much better. I mean, I think it flares up now and then. But yeah, we coping.
All right. Yanong ra tshwana rona ka re mine is also 4 months. Wa gago o 4 months.
Yes.
Wa mo fa di massage ne re bua ka di massage earlier. Wa mo fa ngwana gago baby massages.
Yes, king for maoto, exercise, those kind of massages, yeah. So pulling the legs, pulling them down again. I try to do it often before arobala, just to soothe her. But she did. My son, more because onanali the issue with gas. So usually like putting maoto in and out would let the gas out. Those kind of massages, yeah.
All right. Yanong ona le bana ba babedi.
Yes.
Wa moshimane kwa pele and then wa bobedi ke ngwanyana.
Yes.
What's it like go ba met to these two dynamic children?
It's hard. Being a mother is hard. But I think it's such a blessing. I think when I was the mother, Sapeli. Everything would scare me. The slightest cough, but I think the second one, it's so much better because now you've gone through it. Together is the most precious thing. I actually thought the newborn because he's very personality high. He's the firstborn. He's very bossy. So but he's so loving. He is so loving. He actually surprises me. Yeah, very protective over her. Sure, Mare, it's khatata. I wouldn't lie. Yeah,
khatata. We try like energy ka itse YouTube videos go di etsa. Dinka nako go ba me go nka nako memruti nako. How do you cope ka tsone kaofela di tlhakanse so?
I think there's a season for everything, and I try not hoba everything at the same time. So my husband is also very, very hands-on. He's a hands-on dad. Because pasta together. Teamwork, yeah. So even my husband as in the story time also wakes up every 2 hours.
Oh yes.
And then of course I had to get a nanny. Huge help getting a nanny, and I think that's how I'm able to work around all of that. Otherwise, no, you need a good support system if you're a parent. Otherwise,
get dumela ka taba eo. Bathong Puseletso nako ya shapa. Ntse bua monate ka bana ba hao. Ke a leboga nako ya gago go tla mo Raising Babies 101 o tlo re bella ka bana ba gago and how it's like being a mom. Memoruti YouTuber ka ofela tsone. Ra leboga.
Thank you so much for having me.
Another fantastic show, Momo Raising Babies 101 Infants Edition. Oh, bana, a lot of hard work. Mare, e re ke le gopotseng. Ha re tlhokomele bana ba rona, ka re bana ba rona ke bokamoso ba rona. For me, Carol Ofori, have a fabulous one. Ke tla le bona next time.